Welcome to WHX Insights. My name is Peter Birch. Today, I'm joined by Dr. Meong Hi Son from Samsung Medical Center. Dr. Seong, thanks so much for joining.
Nice to meet you. I'm so happy to be here.
Yes, it's great to have you here. Firstly, I think it'd be helpful if you could provide a bit more context. So it's a little bit about you and the Samsung Medical Center, and we'll go from there.
So I'm a CMIO from Samsung Medical Center, located in Seoul, Korea, if anyone knows about it. And Samsung Medical Center is under Samsung Group that everyone knows of. But we are a non-profit organization which serves about 2,000 beds and also can serve up to 10,000 outpatient clinic patients per day. So that's the size you can think about.
Yeah, it's material. And often I hear about Samsung Medical Center as, the prime example of the next generation of hospitals. But sometimes that concept can feel a little bit, vast and vague. When we talk about the next generation of hospitals, what does that even mean to you?
Before we talk about maybe next generation hospital, what is the current smart hospital?
That's probably a good start.
Is maybe good to start. And actually, Samsung Medical Center is like a 31-year-old hospital. It's pretty young hospital compared to other big hospitals globally, and it's very young, but still like from 30 years ago, from very beginning, there was a vision and also mission, including cutting edge intelligence. And I don't exactly understand what they meant by cutting edge intelligence 30 years ago, but it was always there. It's not something new that has been it's being recently talking about. So it was genetically driven by technology and aiming for the world best smart hospital. Since then, it's not something that we just talk about suddenly about future, but we've been always pushing ourselves toward the future. Yeah,
It sounds like that innovation is within the DNA of the hospital, the medical center. So what does that look like in practice, though?
In some way, it looks exactly similar to other hospitals, because practice is practice. You see patients, take care of patients. But also I really want to emphasize that focusing on technology didn't mean that it was a center of the care. Actually, patient has been the center of the care, and it was a main core thoughts of all the services. But the technology always has been there as a tool. And also it's more about the culture, I think, to build the ecosystem as a smart hospital. So actually in my panel I emphasize it's not so smart hospital is not something like a slow solution that you can just pay for it and buy it at once. It's a build. You have to have a ecosystem starting from network. And we realize that here, we have all the solutions, the slow network, we cannot, demonstrate a lot of things that we can do with the high speed network. So network is so important. Stability and security and speed matters a lot in the hospital, especially for smart hospitals. So the foundation is network, and then hardware, including server. And with so many devices we already have, needs to be connected to each other and work together organically. So all the data that we collect from hardware is there. And then there is a data, an algorithm, then application. So those are the 5 layers. And then we have providers and patients on the very top. So they are the layers of the ecosystem for the smart hospital, and we are working on each layer to be keep up with each other, so we can implement new solution or application when it's brought to us. So it's not about a one definition of smart hospital can be applied, actually.
I'd love to unpack some of those layers then, because that's interesting. At the heart of all of this innovation or next generation of hospital is the technology. And whilst that's important, as you say, some of that underlying infrastructure is critical, but how much of it is the right technology versus, say, the right workflows and process?
So maybe starting from technology, I always talk about technology as the easiest one. And they're always available, ready out there, outside of the hospitals. But it's more about the process, that it's very complex, and I sometimes call it messy. So even at SMC, it's very complicated in some times to actually connect with the technology. So choosing the right technology that can understand our process and also can and use for our process is really important. When I talk about people, it's more complex. Uh-huh. So as we have so many different people with different specialty, and especially when it comes to digital adoption, we have so many different levels of adoption. Some are digital naive, and we all know that. So because we cannot choose because clinicians are not chosen by digital adoption level. Yeah, they have a value of their specialty in clinical field, right? Yeah, so we have to really work on various people who has a different level of understanding of technology, so actually we can integrate digital transformation as hospital, starting from technology, process, and people. So we put a lot of effort to actually engage our people and come up with their ideas and their needs. So we help them to find the technology that works for them.
That's interesting because in this industry, we're not short of people that bring up that very example that in order for there to be a successful implementation of technology, you need to bring the clinicians along with the journey or really focus on that change management piece. But it's often easier said than done. And it sounds like it's very much been done on your side. What's the secret to that success then? You said working closely with people, but to do that at scale.
Yeah, actually, there's no simple answer to that because it's much more complicated and takes a lot of time to build that culture. And also I don't want to sound like we found the answer, because it's all about working every day to make sure that everyone's voice is heard in different channel, and also we work on layers, and also the best way is to empower people in at the front line to come up with the ideas that they want to change process, and they are the one who can actually making changes in the process. So it's all about culture, but also needs a lot of work every day, continuous work, that I have to say that we are I don't want to sound like we found the best answer, but for sure we have a good experience and also good outcomes, that so those those who already had a good cases, actually, and we also let them know that because cases we already have driven by nurses or driven by technicians, and that encourage others people who didn't have thought about think about it. Yeah.
Good advice for people to focus on that long game of building that culture, and that's an important element to have in place to be able to implement things. And when things get hard, you can lean back on that culture to work through it together. I'm starting to think then, like the why behind a lot of this, and because I think you started to touch on it, is ultimately one would hope that by building this culture of innovation and the next generation of hospitals, it is having a better outcome than what otherwise would have been in, say, a standard level of care. So what does that look like for you in terms of measures of success, or that you're doing a good job as the medical center in your day-to-day?
I've mentioned very shortly in my panel that so to maybe change that question to another direction, we are asked so often about ROI. What do you get from your investment or from your work? And it's so also like one action in hospital connects to dozens of different outcomes. So it's really hard to calculate direct impact or effect of one investment or one work. But so you have to really wait and see and have a wider vision of it. Outcomes of the patients and workforce. Of course, there are so many diagnostic or therapeutic technology that we share globally have been implemented and found it very helpful. And I'm not going into like each specific AI solution, but I really want to emphasize there are more operational help that we can get from as a smart hospital perspective. Because when we talk about healthcare AI, more people are focused in diagnosis and treatment, but I can emphasize there are way more than that in healthcare services, such as, for example, there's some you need to understand a little bit about Korean healthcare system, which is a bit different from other countries. That most of patients are covered by national health insurance, and then so there's a huge demand of number of services. So there is a fee for services, and which is very low. Uh, yeah, and also very tightly regulated by government. So we have to really pursue efficiency quite a bit, and that means we need to see a lot of patients in a day, and a lot of patients are waiting in line for the testings, and also we have to optimize the turnover of the surgery. So we can reduce the number of patients waiting for the surgery too. We've been actually working on developing our data. We call it DOCC, and it's not command. We don't call it command center. It's a communication center that we share all the data collected from various departments in the hospital can be shared. And one of very good example in operation is we have 3 to 4 thousand patients having blood drawn for the lab test in a day. Used to have like more than 30 minutes wait for sometimes can be longer, because it's a lot of patients in a day to be handled. But we used our own data to predict the wait time and when can be the busiest time, and then we provided more technician to do that, and now we can everyone can have that done within 10 minutes.
That's a great example of how, getting the perspectives globally in terms of how innovation is done well within a healthcare system. It can provide inspiration and ideas, but to your point, you touched on a really important point that, there's particular nuances or specific requirements within the Korean healthcare system that means that you've optimized around those requirements. And I feel like that's great advice for anyone in their particular area. If they're geographically sparse, then perhaps they're leaning more into the telehealth side and the regional access. So, but there's lessons probably for everyone in all of that. One commonality across any healthcare system that I know is something you touched on earlier too, which is the interoperability side of things. And given the approach that you take of like, well, some clinicians might require different tools. Typically, a CMIO might, or a CTO or CIO might be pulling their hair out thinking about, well, there's all these different tools. It can be difficult to connect them all. And the last thing you want are islands of information that are siloed and not really drawing back through. How do you approach that somewhat insurmountable task of ensuring everything's interoperable within SMC?
It's actually a really good point. Because as a clinician, because I'm a pediatrician and I still practice at emergency department in my patients, and now we have a next generation EMR, because our EMR is homegrown, and previous one still was good, but in a way that integrates all the data collected from patients were not perfect. But with our second generation from 2016, we have one EMR system like a Darwin, and it's not only EMR, but it connects every device in our center and collects the data and so it help us to understand one patient in a holistic manner. So regardless of where the patient is seen by whoever it is, we can have same exact data and in sequential manner. So and easier to understand them. So and also regardless of versions or different devices, it all comes to the one system. So I can view the images and get the report from single login, and it really helps.
And it sounds like you were saying earlier, it's not just then the ability to then aggregate data that provide predictions. That's one important element, but I imagine too, there's probably visibility from a patient side, but also then connecting in with other healthcare systems too. So I guess there's multiple layers to that requirement around interoperability as well.
I really want to emphasize the power of the technology to reduce the workload of our nurses. And it's one of our huge interests to provide smart nursing. So there are many cases, examples of what we've been doing, and we are using the BPOC device. So nurses can scan barcode of each patient to identify drugs and any procedure they are doing. So they don't need to actually type in anything. They just tag, and they will automatically go into the EMR system, including vital signs. And also we now they come up with the idea that they want to take just picture of the patient's skin lesion from bed sores, because they were having hard time staging it for new nurses. So we help them develop algorithm. So with photos, they can just have a suggestion of the stage, and they can provide dressing materials and recommendation, all connected to that staging. So they don't need to, input all the, information as a photo, and also they can, yeah, provide services. And it's a one of the great example that has been generated, come up with the frontline providers. And also we actually empower them to have that idea come to the service. So those kind of service can actually those kind of cases can actually encourage other people to come up with other ideas and how to utilize our data collected from our system to actually connect to the predictive model that can be actually used to reduce their workload, or to reduce cognitive burden. So actually they can use their energy and time more focused on real patient care, because at the end of time they want more time with the patients.
If I was a healthcare leader thinking to this conversation anywhere in the world, someone might be thinking, well, if I asked all of my team members just to suggest something, if they come up with an idea, I might be a bit, inundated with suggestions. And I imagine that comes back to that cultural element you mentioned too. So, and sometimes within healthcare systems, you've got people who work on the business and then people who work in the business. And it's difficult to cross those wires for a particular individual. Is there advice or reflections you can provide to others that might want to try and instill that type of culture, where if someone recognizes an opportunity, like, is it just a big suggestion box that people put things in, or like, what does that actually look like?
It's like learning different language. They have to understand that not everyone is understanding language of business and language of healthcare and language of technology. So I see them as a different language, totally different language speaking. Like me, my native language is Korean, and I try my best to keep up with my English so I can communicate with you. And so I think they have to learn the language. And as a CMIO, I'm trying to be a good translator if they can't speak their language. And I don't speak good language of business that much, but I'm trying to speak a little bit of language of technology and language of healthcare. Yeah, but if language of for those who only speaks language of business, has to really spend time to understand the language of healthcare. So the actually communication is a key factor to actually come up with the ideas to happen. And it's not about, because we just don't want to develop something, but we want to continue using it, right? Because to be successful, we want to scale up. So we somebody mentioned that we don't want to just end from proof of concept. That can be done with any ideas, right? With one person, but we want to have a deep dive communication and learning the where and how it's going to be used, and understanding the environment is really important. So when I say language of healthcare, is not just being able to communicate with healthcare people, but it's understanding.
I love that. And that's something that everyone as an individual too can take away, whatever level or stage or profession they're in healthcare. If we can improve that communication and understanding, and meeting people in the middle sometimes can be a real secret there. On the point around needing to speak multiple languages like clinician and technology, sometimes in that conversation that occurs, there'll be on one hand the technology side, looking at how fast can we innovate and do something new. And then on the clinician side, it's, but we need to make it safe and almost slow down the pace of innovation, because we need to ensure it's double-blinded random trials and appropriately tested and whatnot. Do you think that innovation and safety are on this continuum that you can only be on one particular side, or how do you kind of marry the two together?
Actually, that's one of the challenge we also have, and I refer it to as I use a metaphor of clock. 'Cause technology and healthcare has totally different clock. Technology has, it has a clock in seconds, and medicine traditionally has had this clock in hours, maybe days,
I was gonna say
years.
days.
And first of all, I think both sides need to understand each other have different clock. And we cannot really force into one direction, because our ultimate goal is actually safety and the best care outcome of the patients, not about the speed of the technology adoption is not ultimate goal. So we cannot really force healthcare system to adopt the speed of technology. But on the other hand, our healthcare system also have to understand that with the help of different clock, that's and also the with the technology provided by with this clock, can actually change and shift the paradigm of healthcare. And then when the paradigm is shifted, we cannot really stick to the paradigm we had in the past. So this has to be understood. So we cannot have the same time frame that we have for the validation of the drugs when it comes to the softwares provided to patients, because it has a different grade of the safety margin. Yeah, that's what I think.
I love it. And lastly, thinking about, I guess, that changing paradigm over time, if in 10 years' time we were to reflect on this conversation around the state of innovation and how technology is used and what a smart hospital or the next generation of hospital looks like, what do you think you'll reflect on? Do you think much will have changed? What would be different? Or what would you hope that you look back and go, yeah, we're on the right?
So I think future of smart hospital. First of all, I think it's not gonna be in the building. It's not restricted. So it's not gonna have world like this day we have. So right now, Samsung Medical Center. When we talk about Samsung Medical Center, it's in Seoul, Gangnam area. But I think maybe in 10 years, not every patient need to come to Samsung Medical Center to have a care that they need to have right now. And hospital care will come to where patients are. And that's the first thing I see as a healthcare. There's gonna be a huge shift from hospital care to home care. So the space limitation and also time limitation, will be totally different. It will be solved in many ways with help of patient-reported outcome and also wearables. And we already have IoTs and technologies are there. It's more about policy that we have, and also the culture has to be changed, and we have to understand how we're gonna take care of these patients well enough so they don't need to come to the physical hospital. Yeah, but it's gonna be a huge change especially because of that. I really envision that agentic AI and robots robot as an embodiment of AI will have a critical role to actually provide those services in addition to the real healthcare providers. And I never say that they're gonna replace anything, but they will be the good helpers to actually to provide the service that we cannot do right now.
I love that. And we'll have to put it in the calendar to have that conversation in 10 years' time, but hopefully I speak to you soon.
I think it's going to happen even earlier than 10 years. And from my experience, technology, it always go faster than our expectation.
Sure does.
And it will accelerate further. So maybe 10 years is too long to
100%. And look, I think the industry will be watching on with interest. So I really appreciate you taking the time to have this conversation with me today, Dr. Sun. Thank you so much.
Thank you.
And thank you for joining us on WHX Insights. Make sure you subscribe on Apple Podcasts, Spotify, or YouTube so you can catch all the future episodes. My name's Peter Birch.